So currently we have these very promising data from KarMMa and from CARTITUDE-1, which basically showed us that BCMA targeting CAR T-cell products can be very effective in heavily pretreated myeloma patients. But of course, we do know that despite these very good results, the majority of patients will relapse. And so the question is how to improve on this. Well, a first strategy can be to bring in the CAR T-cell products earlier in the treatment algorithm, meaning at earlier relapse. So this has been studied in two important studies. The KarMMa-3 study that has compared ide-cel with standard of care regimens, like for instance DPD or KD, and in patients who have received 2 to 4 prior lines of therapy. So those results have been recently published in the New England Journal of Medicine, and they have shown a highly significant benefit for ide-cel compared to standard of care in terms of progression-free survival. To be more precise, median PFS with ide-cel 13.3 months, with standard of care regimens 4.4 months. With no unforeseen toxicities with the ide-cel. So the benefit of this approach is that we give one single shot of CAR T-cells and there is no need for prolonged treatment duration. CARTITUDE-4 results will be released at ASCO and EHA, and they have compared cilta-cel with DPD or PVD. And in patients having received 1 to 3 prior lines of therapy. So we look forward to these results. And finally, you could also bring the CAR T-cells even earlier. Let's say for patients with high-risk myeloma who still have the highest unmet medical need, there are small phase 2 cohort studies that have explored the role of ide-cel and cilta-cel in patients relapsing within 1 year or 1 year and a half after autologous stem cell transplantation. And although the data still need to mature, at first sight they look very promising. And of course we could also think of bringing the CAR T-cell products into the frontline treatment algorithm. And also there are ongoing studies with ide-cel and cilta-cel. But of course we need to wait for these trials to be fully enrolled before to draw any conclusion. But at least I think the landscape is evolving very rapidly, and this is of course in the benefit of our patients with multiple myeloma.